Now let's talk about infertility. In anovulatory women, infertility may be overcome provided that the ovary is capable of producing mature ova and the appropriate steroids. Clomiphene and tamoxifen are antiestrogens. They work by inhibiting the feedback inhibition of estrogens in the hypothalamus and so increase FSH and LH release. Gonadotrophins are used in women who lack appropriate pituitary function or do not respond to clomiphene therapy. Treatment starts with daily injections of menotrophin, LH and FSH in equal amounts, or recombinant human phallotropin, FSH, followed by 1 or 2 large doses of chorionic gonadotropin, mainly LH, to induce ovulation. In men with hypogonadotrophic hypogonadism, both gonadotrophins are sometimes given to stimulate spermatogenesis and androgen release. Now let's talk about testosterone. The most important androgen in humans is testosterone. About 2% of testosterone in the plasma is free, and in the skin, prostate, seminal vesicles, and epididymis, it is converted to dihydrotestosterone, DHT. Androgen deficiency is often treated with intramuscular depot injections of testosterone propionate. Alternatives include transdermal patches and buccal preparations. Let's talk about effects now. At puberty, androgens cause development of the secondary sexual characteristics in the male. In the adult male, large doses suppress the release of gonadotrophins and cause some atrophy of the interstitial tissue and tubules of the testes. Finasteride inhibits reductase, preventing the conversion of testosterone to DHT. It reduces the size of the prostate gland and is used to improve urine flow in patients with benign prostate hypertrophy. Let's talk about its adverse effects. The continuous administration of estrogens for prolonged periods can cause abnormal endometrial hyperplasia and abnormal bleeding patterns. When progestogen is given with the estrogen, there is a decreased incidence of ovarian and endometrial cancers. Thus, women taking HRT must also take a progestogen, unless they have had a hysterectomy. Let's talk about progestogens. Progestogens are used for hormonal contraception and for producing long-term ovarian suppression for other purposes, for example dysmenorrhea, endometriosis, hirsutism, and bleeding disorders.